I know the issues of intellectual property rights will come in place, but I think to be able to clean the system and to do away with this indiscipline and this corruption, because that's where the corruption is. The corruption is dwelling on the revenue collectors, some of them who are not licensed by central bank, but they are contracted by county governments. I think there was a county in the coast which I think the percentages were almost 25% or something like that, in terms of the revenue or the commission that is taken by the service provider. So that's a question. Should we be looking at that? Because I'm just trying to imagine a situation where you, so moto, decides that this is what we're going to do. Maybe it can be questioned by law. Can we then support you in Parliament specifically to ensure that there's discipline and also to ensure that at least you can be able to follow the money trail from the client to the service provider to the county revenue fund, and then also from wherever it goes. Because if we were to do a project audit, if we were to change the system audit and you do a project audit, we will actually be able to reduce on corruption. But currently we just have figures. It's not line item. It's not project based. It's just just figures. They say, oh, we're going to spend 5 million on the road, but it is not. There's no narrative to say what the 5 million is all about. So I just want to engage you in that conversation to see how best we can be able to assist, put discipline there, and ensure fiduciary responsibility.
Thank you, Chair, and thank you, Senator Olekina. I would have to beg to differ. If we go that way, we will continue perpetuating an illegality. Honourable Chair, the Public Finance Management Act says that National Treasury will prescribe the systems to be in use. Now, the Public Finance Management System includes revenue collection and expenditure systems. What happened at the onset of devolution is we had a lot of briefcase suppliers of revenue systems that cropped up all over. And counties recruited them to raise their revenues or to collect for them. Then every subsequent change of administration, you will find some of these counties changing their revenue collectors for whatever purpose, without proper due diligence on whether the systems work best for them or without negotiating the terms for that collection. We have to go back to the public finance management system. We have to ask National Treasury to come in and prescribe the public finance management system for revenue collection, which should be standardized. We should not have, for example, County A paying 30% of their revenue as commissions to a certain service provider and County B paying 75% or 50%. It should be standardized, because that is where we are also losing a lot of revenue. We have different service providers from different counties charging different rates, using different systems. Some we are not even sure of their reliability, and that's why now I have my data team, my information systems and data analytics team doing some of these assessments. Let's go back to what does the law say, and how do we curb this proliferation of so-called revenue service providers and these changes that keep occurring as and when. You have some counties, for every revenue stream has a different revenue service provider. That is wastage of resources. So you can imagine, I think at one point, I think Senate requested me to give a list of all the revenue. I don't know whether it was
some of these problems. I think that's a real challenge that Senate has noted. And that would include, I think, in counties like Narok, a legal battle between counties and those service providers. I think something beyond EU, of course, would need to be done so that we solve some of these problems. I think that's a real challenge that Senate has noted over time, CPIC has noted over time as we engage with counties.
Chair, through you once again, I'm really still very patient, awaiting the response on the reason as to why Nairobi County hospitals have not been audited, and still which criteria did you use to audit some of the hospitals that then you cannot apply to audit hospitals in Nairobi?
Members, you are moving very fast, but as I had directed, I think we have the document here with us. So I think auditor questions touching on this, you can still respond to them.
Yeah, and Chair, actually I've looked at the document.
Yes.
And the response from the Auditor General does not capture Nairobi County.
It does.
And that's why I'm keen to get to understand from her.
Go to page 8 of the document. It is listing about a number of counties which did not submit audited reports, Nairobi included. Paragraph 19. But the auditor will respond to that as well. So, auditor, proceed.
Thank you, Chair. As Professor Tomo Jenda has indeed pointed out, similar to what Senator Olekina pointed out, that these commissions and charges are actually expenditure of revenue at source. And we have been raising some of these issues, that indeed the county should get the gross revenue and then pay the percentage. That is an issue that this committee can raise as a recommendation, high-level recommendation, as a cross-cutting issues for all the counties. You have the Honourable Senator has also raised the issue of late audits, which Honourable Tabitha has also reiterated. And indeed, Honourable Chair, it's only that we went straight to the issues for clarification. My report does indicate the 14 counties that we have not audited hospitals, Nairobi City included. We have Mombasa, Kajiado, Narok, Uasin Gishu, Tana River, Taita Taveta, Lamu, Busia, Kakamega, Isiolo, Meru, Tharaka Nithi, and Kirinyaga. But this one now we are pursuing in the 2023-2024. We, even to audit some of these hospitals, Honorable Chair, we've had to work very closely with the Council of County Governors to assist us in speaking to the hospital administrators and to their chief officers for health to ensure that we get financial statements, including in arrears. And we are doing them in arrears, and that explains sometimes why there is also there have been delays. But I believe as of now, you have received all the hospital reports that we have audited. They should have been tabled. So now we are up to date, not for all, but for the ones that submitted financial statements for audit. So
I just wanted to emphasize that Nairobi, where there's a delegation from Nairobi called Senator Tabitha Mutinda, and Narok, where there is the senator, the whip, has not submitted, so that he just takes note, because I think he might not take note. Very important.
Yeah, we in our examination of hospitals, we realize that the reports for 2021, 2022 are there, at 2022-2023, they are awaiting for your certificates. So most of them we haven't touched on 2022-2023 because the certificates are not ready. So once you make them ready, then we will deal with that as well.
Chair, what I'll need to find out when I go back to the office is whether they have not been transmitted, because I have signed every certificate for every hospital. After the conversation we had with you, and I requested for 3 weeks. This is now done. So maybe it's the tabling process and then the commitment to the committee.
Okay. We will ask the clerk to follow up. Could be maybe they have not been tabled. Okay. Yeah. You can proceed.
Sorry.
Chair, maybe they were not tabled because the House is on recess, but they will make follow-up and confirm and report in the next meeting, in tomorrow's meeting.
Okay. So, any other issue?
Yes, thank you,
Now
Chair.
we are in this report.
Yes.
So ask matters related to the content of this report. Proceed.
Chair, when we actually started, we said that the Auditor General is normally very busy. And it's good that we also use this platform to raise the concerns that we've been having. My point is this. I was just consulting with Senator Lekina on the if the county owns yeah, you've told me. But now I noticed that the county of Meru owns the Leopard Rock Hotel Lodge. I don't know if you're aware and if you've actually have any information as far as the audit report is concerned.
Honorable Chair, I was just consulting my deputy to just respond to that, please.
Thank you very much, Auditor General, and through you. Yes, indeed, the Meru government owns the hotel through the corporation that was created. So there is a Meru Investment Authority Corporation, I don't have the name right, that actually owns the hotel. And we do audit the investment corporation. Yes, I submit.
Chair, maybe before we begin looking at this report which is being submitted by the auditor, I have a concern, and I just wanted to understand how you separate the two. The counties that you've listed here in paragraph 9, which is 19, sorry. Nairobi, Mombasa, Kajiado, Narok, Uasin Gishu, Taita. I'm just curious whether you carry out two different audits. You carry one audit for the executive and you carry another audit for the municipality. In the case of Nairobi County is sort of like, is Nairobi City County, it's an elevated municipality. You know, how do you deal with us? Because I've never seen an audit report from a municipality. I've only seen audit reports for the executive. Okay, so I'm a little bit sort of like confused when it comes to that. So if you can just clarify it, it might help me.
I think for correction, we are dealing with the audited report for municipalities. So they are there. What we don't have is the cities.
The cities, right? The reason why I'm asking that is because in your paragraph 19, if my colleagues will let me just, I want to be clear. I don't know everything. It's good to learn. This is for the hospital. I'm talking about the municipality. Sorry, this is for the hospital. Or maybe can I put the question in
Sorry, Chair.
Can I shorten the question?
Yes, we are moving from paragraph to paragraph.
No, 19 is different, sorry.
But we can also go to 6 and 7.
Let's go to 6 and 7.
So I have to keep flipping through my document.
Or maybe what we do, members, we just go page by page.
Yeah, okay, let's do that. Let's do page by page. I was trying to make it easier so you don't have to read everything, but for us to go back and forth, let's go the way the chair have suggested. Keep my question in mind in terms of the city, municipality, county, municipality, because I'm sure my people in Narok are confused. How do we audit? That's why they probably have not submitted. Or if they have submitted, you can share that with us.
Let's start with page 2. Any member who has an issue on page 2? No. Page 3?
Wait, slowly.
Page 4?
Wait.
The same thing.
Page 4, maybe auditor, this is where I had early on raised an issue. 4 extending to 5, the issue of non-submission of financial statements. I don't know. It has been answered, yes, but I think we had a problem with a number of counties. One of the key counties that has this problem is Nairobi, especially for funds. There were no financial statements submitted at all. So I don't know what your office is doing to ensure that these counties comply with the law.
Chair.
Yes.
A point of order.
Yes.
And I don't want to talk for the auditor. I think that was the issue that you raised, and it was also disturbing me. And the auditor was very categorical on this issue. She has given us a certificate, a proper opinion. I think what the committees of parliament have not been able to do, and this our committee has been very, very, should I say, kind, is that we have never evoked, or rather invoked, section 62 of the PFM Act. Because section 62 of the PFM Act is very clear on what we should do as a committee in terms of dealing with people who have got late submission of documents. So I think that if we were to take the opinion given by the auditor strictly as has been given, then you can be able to deal with that matter. Because otherwise there's no any other thing that the auditor can do.
So I think that matter will handle it internally in our reports. Page 5. No question for page 5. Page 6.
Actually, there is a question for page 4.
What is
with your through your chair, perhaps
yes.
You could also indicate the paragraph, because I'm using a different
yes.
document on pages.
Yeah, you are taking us.
You indicate the paragraph that you're referencing. My paragraphs flow with your paragraphs, but my pages may not flow with your pages because I'm using the iPad.
Now, I'm focusing on the inaugural audit of municipalities, which is paragraph 8. Can you
proceed?
There are two issues here. Sorry, Auditor, and maybe you can help us understand this, because you've indicated that there are 110 gazetted municipalities, but in the inaugural year of 2019-2020, you only managed to audit 46 of them. Is it that there is no sufficient information to the counties, to these municipalities, to this council of governors, that they have to keep financial statement for all the municipalities, that is causing you not to be able to audit all the 110 municipalities? Number 2, going forward, when it comes to this, you've raised a concern on paragraph 9. on the increased number of adverse reports. I've also noticed that there are a few disclaimers, which means you are limited by scope of audit. What do you think is a challenge, and what can we do as a committee to be able to assist? Because I don't even think my county of Narok has submitted financial statements for the municipality to be audited. And maybe it's because of lack of information. What can we do to be able to now? And I think this is a proper way, Mr. Chairman, of ensuring proper financial prudence in counties, because you are not leaving any level. You're going. I'm sure soon you'll be auditing economic blocks once we legalize them, because they are just clubs of counties. So maybe can you help us understand those two? Because I really would want my county of Narok and also all the other 46 counties of Kenya that has municipalities to be able to submit them for audit, and we can interrogate them here in this committee.
Auditor.
Thank you, Honorable Chair. To respond to the concerns of Honorable Senator Olekina, perhaps we need to go to my statements under paragraph 24 on the steps taken, or E, the section E of my submission. Paragraph 24. From paragraph 24. Steps taken by the office to ensure that all entities are audited. And this is where we have been working very closely with the National Treasury, the Council of County Governors, and engaging directly with the county executives so that we get these financial statements for audit. Now, you will find that some of these municipalities may have been gazetted, or sometimes you'll find that indeed the municipality is operationalized, but all decisions and transactions are being done at the county level. So those are some of the areas, and when we were having an informal discussion, I said we may need to look at the law or the regulations in when we establish or gazette a municipality or a town, the transition process and period, when do they completely separate? The same thing with the hospitals. Hospitals are now self-accounting, but I'm finding a lot of the operations are still being handled under the county executives. So perhaps this committee can look at transition period when they are established as self-accounting entities. So this would solve some of these issues. My directors in the regional offices have instructions to pursue the separation and to seek for these financial statements. And of course, this is an issue that I've been raising the Public Sector Accounting Standards Board, indeed, to even prepare the templates, and even issue maybe a timeline when these templates should be used by each municipality and each town. This can really be of assistance to the office.
Mr. Chairman, if the auditor can go to page 20 of her report. Paragraph.
We said we go page by page.
He said page by page, paragraph. What paragraph is this? It's an annex. It's the annex, yes. Appendix 1. Of interest to me is list number 92 and 93. And Auditor, I'm taking you back to your earlier statements where you said counties submit their information, and most of the time that information is not accurate. I've noted that my county of Narok has got 2 municipalities, but there's no date of establishment of these municipalities. Was it like an oversight, or is it that you could not be able to tell? Because if you look at 92 and 93, it says Kilgoris municipality, date of establishment, 0. Operational, none. So that means they don't exist. Because if you don't have a date of them being established, how can you be able to...
Honorable Chair, you'll notice even in the body, Tharakanithi, we have a problem. Right. For me to pronounce myself on the date, I have to get the Gazette notice. So that's what we are trying to get. On the ground, we are told it's a municipality, but I have to get the Gazette notice that established that municipality, and then I will pronounce the date from which now I will request that they submit financial statements.
Or maybe they're not gazetted.
We are trying to. I still have my team on the ground trying to trace that.
Okay.
Yeah, there are about 3 of them. I think the Rakanithi also. I have a problem with that.
To make sure that it's
So, page 6.
Chair, kindly, with your permission, even before we move to page 6 very quickly, the question Senator Lekina had raised, which is on paragraph 7, so that we just avoid going back and forth on the issue of the cities. Senator Lekina had raised on the issue of cities like Nairobi City, Mombasa City. If you could highlight on that, because I see you have some explanation according to your office.
You are confusing us, because what Senator Lekina had raised was on page 8, which we are yet to go to.
And there's a question Senator Lekina really emphasized and requested the Auditor General to kindly respond. And I've seen she has some response here so that we don't forget about it as far as the cities are concerned. On paragraph 7, Chair. How do you handle municipalities within the city? I see that the answer that comes out, according to the Auditor General, is that according to our office, but I want to maybe clarify this, is that all counties are the same, either be it a city or a non-city. They are all 47, because she puts it like the Nairobi and Mombasa cities are deemed to be Nairobi and Mombasa counties, as stipulated by Section 6 and 27 of the Urban Areas and Cities Act. So that's why I'm saying if we could,
Yeah. I think my understanding of that statement that I've got municipalities, right, that are separate, but Nairobi
and Mombasa
are both counties entirely and cities at the same time.
Yeah.
So that is the explanation. But and the audit of the cities doesn't feature here. But that's what I'm getting.
I think I remember my question properly. And the question was very simple. How do you treat Nairobi and Mombasa now that they are cities?
Yes.
I know the governor of Nairobi has been talking about establishing boroughs.
Yes.
Are you now going to be looking at auditing those boroughs? Is it like an act of the assembly to be able to do that? And then maybe to expand that question a little bit, is that, and maybe the question I'm asking might sound very weird, but are there municipalities in Nairobi now that it's a city?
Honorable Chair,
Before I respond, I think it's a borough, not a borough.
Honorable Chair, if you look at the report that I submit on Nairobi County and Nairobi and Mombasa, the actual heading of that report is the Auditor General's report on Nairobi City County and Mombasa City County. You will not find it in any other county. The others will be Kisumu County or Nyeri County, Narok County, Honorable Lekina. But for Nairobi, they are both city and counties in terms of, we don't have a board or a municipality. Now, if they do establish boroughs, we'll look at the law. Most likely it will come to you for maybe comments or guidance to the county assembly. And then we'll see whether they are coming in as self-accounting entities aligned to municipalities or towns, and they must now submit financial statements. Indeed, these entities are audit have to find out if they are established by a law. And this answers the question for Nairobi funds that the chair raised. Nairobi has only established one fund, the alcoholics one. We don't have any other funds that the county assembly has established, which I audit and we should come to you. But if they do, then it will be under my purview and I will submit the financial statements.
So, honorable members, any question on page 6? If none, page 7. Page 7, paragraph 17. There is that table down there, Madam Auditor General, where you have indicated that we have 358 level 4 hospitals, but you managed to audit only 50. 50 for 2021-2022. And then the number increased to 195 in 2022-2023. Maybe you can tell us more about the deficit. Which are these counties?
Thank you, Chair. If you look at paragraph 18, I have indicated that a total of 193 or 54% of level 4 hospitals did not submit financial statements for 2021-2022, while 163 or 46% of level 4 did not submit for the 2022-2023. So these have not been audited. And this is now why we keep working with the Council of Governors and the county governments and my directors at the regional offices to ensure that we speak to these hospitals to submit these reports. I know that one of the challenges they're having is separating activities from the county executive to the hospital to be self-accounting. But Honorable Chair, the county executives need to know that now the hospitals are self-accounting and they must separate. And I know one of the reasons could be hospitals are also providing quite a bit of revenue for the counties. So it is easier to hold on to the hospital and report good revenues, but they forget that you must also give them funds for expenditure. So that transition that I was proposing, that when an entity is self-accounting, there must be a separation timeline. It should be maybe handled at the committee level, either as part of regulations or as part of amendment to the law. So we are still pursuing.
So maybe on this one, clerk, you can write to these counties and ask them to, that is important that the hospitals are audited by the Auditor General, and that not submitting financial statement is a violation of Section 164 of the PFM Act, and also the Public Audit Act. So I think we need to trigger a letter to those affected counties. Page 8 is where Senator Olekina addressed an issue on paragraph 19. That is the 14 counties which have not submitted any financial statement so far on hospitals, including Nairobi, where Mutinda comes from, including Kakamega, where they have a big investment, almost a level 7 hospital. And Isiolo, Tana River, Mombasa, Kajiado, Narok. Maybe you can respond to Senator Dama.
And Chair, on the same floor of the hospitals, and I like it the way you emphasize on Nairobi, because my emphasis, Madam Auditor, you realize we have one of the biggest hospitals. Case example, Mama Lucy, Pumwani Hospital, Bagathi, and these hospitals have been having quite a number of issues affecting Nairobians. I would also want to hear from you, what extra are you really doing as far as these city hospitals are concerned?
Chair, the issue that the auditor has raised on revenue generation by facilities like hospitals to the county is a very important one. The other side of it, which is a supply side, is that the hospitals also do face a lot of challenges with recurrent expenditure, because most of the times those expenditures are actually need-based expenditures that needs to be there. so that you find two types of hospitals: those that still must remit all their money back to the CRF so that they can be able to, get their money back, and others that have explored different structures to ensure that some money can be able to remain to be able to run these hospitals. So my question is, could you give us a comment on what you see as facilities improvement funds? Is it an effective fund in general, or specifically would it be an effective fund to ring-fence some of these resources for the running of the current budgets in hospitals? And in your audit process, have you encountered counties that don't have this particular fund? Because, for instance, your comment that Nairobi has got only one fund, is it a possibility that Nairobi, for instance, that has got almost 164 hospitals, does not have FIF, the Facilities Improvement Fund? And if that is the case, then what becomes of the hospitals in those counties with regards to running their daily expenses, or rather their recurrent budgets? What would be the strength of FIF in your view?
Madam Auditor General.
Thank you, Chair, and thank you, honourable members, for the concerns and the questions. Indeed, there is a concern that we need to expedite the issue of Nairobi, especially, and of course, notwithstanding that we have other counties that we are still working with, and probably by end of this week or next week, I will know from my directors which hospitals they have spoken to, because I've asked them to visit these hospitals and speak with the chief officers health in every county. But as much as I don't like making promises, Honorable Chair, maybe I can also speed this up by doing a flash audit on the operations of the Nairobi hospitals, just high level, without going in depth, and the relationship with the Nairobi County. Because you realize there has been a bit of a history. Some of these hospitals were being managed previously for some time period by NMS. Now I think they should have been handed over. So I may think of, I'll look at my resources, doing just a quick high level exploratory or flash audit, just to see how are these hospitals operating, and then maybe give high level recommendations for this committee. As special audit, yeah, maybe it can unlock and even as you write to the governor and they have received drugs or medical commodities, and they have it has not those drugs have not been paid for, then at the county executive level we should have a listing of these pending bills related to this hospital or this medical facility, which now should be disclosed in the financial statements of the separate hospitals. So let me leave that at that, Honorable Chair. Please don't press me for timeline, because we're in the middle of 2024, but I will make sure I speak to my specialized team we just do a quick flash audit, high level, probably even a desktop review of documentation, and then we can give you a report. It doesn't have to be the usual report through the, we can agree on the modalities.
Senator Agenda.
So I'll just quickly, just a quick one.
Maybe as an issue related to what?
Yeah, related to this. Two, you've talked about NMS. The cutoff was clear because NMS operated pursuant to a concession by the county then, through the governor then, to cede certain control of certain functions, and perhaps, so the cutoff is clear. With this regime, we have not had NMS. So that's a 2-year period that NMS is out. Number two, this desktop, this flash audit you're talking about, what time frame would that take? I know you didn't want, that was a question I was going to ask, and is important. And how many hospitals are you looking at? I'm sure you already have that bird's eye view. We know that KNH is level 6, Paraceto, different audit system. Now these others, the four, level 4 and 5, how many do we have? Do we have some that you've talked about the streams? I was also concerned about the same things you've raised. Pending bills, lines, expenditure lines, what the county inputs into the feeds, because there are different feeds. Whether even when you audit the county, you have feeds that talk about income from hospitals, whether they specify those hospitals. Yeah, thanks.
Auditor General, proceed.
Thank you, Chair. I'm trying to go back and forth with my documentation. Honorable Chair, let's discuss the timeline, because I don't have a single officer now who does not have an assignment. And as I said earlier, they all know the clients they need to deliver by a certain point in time. I will speak to my specialized audit department to see if they can spare 1 or 2 or 3 officers. So allow me to communicate later on this. We'll do a census of the hospitals, and we'll know how many we are talking about. I don't have the number off the top of my head currently. There was the issue of facilities improvement fund. I'm trying to check. Honorable Chair, I did submit to this committee a summary of the hospital's reports. I do not know whether you have been able to interrogate it for all the cross-cutting issues. And this was one of the issues we were raising.
We actually did.
Yes.
That's why we have started the process.
Oh, good. My concern with I know it's still under discussion. My concern with the creation of the many funds we are creating, and especially in the health sector, is whether we have solved the prior challenges of previous funds. Because if we have not thought out what challenges there were, so that now we can agree that we want this particular fund to assist, then we may not solve the problems or the challenges. There has been a lot of debate on not just the facilities, but also the equipping and staffing some of these facilities. We have implemented construction projects of dispensaries, health facilities, and quite a number of them are just closed. Very beautiful premises I've seen. They don't have staff and they don't have anything else. It's just a nice branding that is there. So it would be important for us to ensure that even as these issues are brought to you, that we look at what challenges have we been having with funds, especially in the health sector. If we are talking of universal health access, have we thought out the delivery of universal health to all? We now have the 4 entities that were created by the Social Health Act. At what level are they working with the counties? Because it's the counties that will deliver universal health, because it is a devolved function. And that is where this committee can come in and look at the modalities, the regulations, and the law in terms of seamless integration between the health facilities at the county level and provision of health care to the citizens. So I would not want to comment about a fund that is still under at high-level discussions. Some have established, but you can see that they still bring their debate to the national level, especially when it comes to replacement of equipments and other maybe not medical supplies, but equipment that are supposed to be part and parcel of health provision. So this debate actually goes at a higher level. It's not a comment I can make and it becomes a panacea or a solution for what ails health. But if the hospitals are going to create this, then it means they must be putting in some money and sooner or later that fund must be self-revolving based on the revenues the hospital is collecting. But if the revenue is going elsewhere and then they are given a little by maybe if it's a county executive, then it may not be sustainable. Let me leave it at that.
Can I, Mr. Chairman, just on literally 30 seconds. The question asked by Senator Eddie Gishero was advised by a situation where we found ourselves in this committee, whereby the county government of Kilifi has got an existing fund to run the hospitals. We know a few other counties do have that. But now we have this facility improvement fund, which has been passed by the National Parliament, that cuts across all the 47 counties. If you look at the person who has been given the responsibilities in that fund, it is a CCM Health, which brings in a conflict with the CCM Finance as per the PFM Act. So the question, I think, which is a bit confusing is, now for you, which fund are you going to be auditing? If you go to Mombasa County as an example, or let's say Kilifi County as an example, they have an existing fund. Do they dissolve that fund and then apply the terms of the new FIF fund, or do they continue implementing their fund as it was established about 6 or 7 years ago, or do they run both of them at the same time? You know, so that's and then how does it? What, according to you, is the neater way? Because you cannot really apply anything retrospectively. You know, you have to think about, you know, the future. So do you do away with it, or do you proceed?
Chair, this will depend on the duplications that may arise. Because if we have the FIF and we have a fund already established at the county and they are providing the same services or handling the same issues, then there will be a clear case of duplication which will be raised in the audit report, and then a recommendation can be given as and when the two funds find themselves running concurrently. But it's a discussion that can be had with the governor because there must be pros and cons on why the county established, how has it been running, and when now they start running the other one, how do we ensure there is separation, and for how long can they run concurrently? So that is a decision that needs to be made once the FIF is up and running.
Members, page 9. Any question on page 9? Page 10. Page 11. Page 12.
Chair, I know you asked the members if they have an issue, but I would want to bring to your attention the performance audit reports that we have issued, that this committee can also take, maybe look at.
Proceed.
Affects. If you look at paragraph 26, I have indicated some performance audit